So you want to lose weight to help your knee osteoarthritis pain, but your knees hurt too much to exercise. It's the ultimate catch-22, causing high motivation but often leading to burnout. But in this video, I'm going to show you that it is possible to lose weight and get your knee feeling better in spite of your current pain. First, let's look at the math because it's highly motivating. So studies show that for every 1 pound of weight you lose, you remove 4 pounds of pressure from your knee with every single step. So what this means is that 10 pounds of weight loss equals to 40 pounds of decreased pressure in your knee joints. And this change alone can lead to life-changing pain relief for a lot of patients. So when you think about weight loss, we often think about cardio or cardiovascular exercise. The goal of the cardio is to basically, we elevate the heart rate by doing some sort of an aerobic exercise, and thereby it strengthens the heart and also indirectly burns calories. So you burn calories during exercise and also after exercise by increasing your metabolism and thereby forcing the body to lose weight. But the biggest question is that, how do I do an aerobic exercise when my knees hurt too much? So try starting with low impact exercise first. So option 1 would be aquatic walking or swimming. So basically, if you have access to a pool, you can consider walking in the pool or you can consider swimming. But let us say if you don't have access to a pool, you can consider option 2, that would be biking or elliptical. 2 great equipments that can help burn calories without stressing your knees too much. So a landmark study showed that the elliptical actually has the least cartilage strain of any partial weight bearing exercise. So it's a good cardio to burn significant amount of calories and is also safe in the long term as well. So walking is a great exercise for knee osteoarthritis, but some people may not tolerate it right away. So in that case, what I would recommend would be to start with 10 minutes of walking and then combine with biking or elliptical to get a 30 to 60 minute cardiovascular workout. But slowly, you gradually progress on the duration of walking, and thereby it may take up to 6 months to get to 30 minutes of brisk walking, but that weight is helpful in helping to condition your knees to tolerate that much amount of walking without causing aggravation of your knee pain. If you're using a bike, dial the resistance down, especially if you're pain behind the kneecap. And also, adjust the bike seat height in such a way that when you pedal fully, you only have slight knee bend. Keeping the seat too low is going to force the knee to bend too much and thereby putting more stress on the joint and thereby flattening up your pain. However, if you're having severe knee pain and these low impact exercises still aggravate your knee, then I would recommend discussing with the doctor. So let us say if the patient comes into my clinic and have these concerns, we discuss about medications or knee joint injections to help their knee pain, and thereby they can participate in the exercise program. In some patients, I often talk about weight loss injections as well, where these weight loss injections, in addition to the lifestyle, can help promote weight loss, and thereby they can also start to participate in their exercise program as well. So now what about jogging? So jogging can significantly increase the joint load, which is risky if you have knee arthritis pain. However, if you're losing weight and your pain is improving, you can start to add 1 to 2 days of jogging into your routine. I still wouldn't recommend jogging as your only source of cardio even after you lose weight. I would recommend supplementing with the low impact exercises that we talked about. However, if you're a dedicated runner, I've covered in a separate video whether running is safe with knee osteoarthritis or not. I'm going to link that in the description box below. So even though this video is about how to exercise to lose weight, the truth is that exercise alone is not enough to lose weight. You can still lose weight without exercising as well, but exercise is still vital because 1, it strengthens your heart, and that is important for longevity. And the exercise also provides mental health benefits, which is helpful in the long term to lose weight. And the other thing is that movement helps to preserve cartilage in your knee joint as well. And honestly, consuming 300 calories is nothing. For example, one day I was walking in the clinic and somebody offered me a cookie, and in a split second I made a decision to get the cookie and I ate it, and that's 300 calories. And even if I had spent almost like 30 minutes of cardio exercise, that's almost reversed by that 300 calories of cookie right away. So for weight loss, healthy habits are key, and just follow these 4 principles that I discussed with patients, and that's more than enough to help you kickstart your weight loss journey. So number 1, no high calorie foods after 5 p.m. So basically keep your dinner light. So it could be either 2 cups of vegetables with some protein like chicken breast, or it could be some lentils or something like that. Number 2, so increase the volume of food without increasing your calories. So basically try to consume a lot of vegetables and fruits in your diet. So usually I tell my patients to focus on at least 5 servings of vegetables and 2 servings of fruits daily. Number 3, say no to liquid calories. This is very, very important. I cannot stress this enough. So basically say no to sodas, say no to milkshakes, say no to sweeties. Number 4, try to fast for at least 12 hours daily, at least minimum. So basically if you finish your dinner by 7 p.m., make sure that you give at least 12-hour break before you have your first meal of the day. So in addition to cardiovascular exercise and healthy eating habits, make sure that you add 2 to 3 days of strength training exercises to support your knee. And if you want to get started with knee osteoarthritis rehabilitation, then check out this video here. If you want to know how I treat obesity in my practice, then check out this video here. I hope this video was helpful. If you really found this video helpful, please make sure to hit the like button and put some appreciative comments. This can really help out this channel. And I'll see you in my next video. Until then, goodbye.